everyone, today I will be presenting a short case on soft tissue swelling due to infection or abscess. Soft tissue infections are quite common and can occur after a small injury, cut, insect bite, or surgical procedure. These infections involve the skin, soft tissues, muscles, or fascia, and if not treated early, they can spread rapidly. The most common case is bacterial infection, especially by Streptococcal aureus and Streptococcus species. Clinically, patients often present with pain, redness, swelling, warmth, and sometimes fever. Radiology plays an important role here. It helps us determine the date of infection, detect abscess formation, and assess whether the infection has spread to nearby structure like bone or muscles. Among all imaging modalities, MRI is considered the best because it shows excellent soft tissue details and can clearly differentiate between cellulitis, abscess, and necrotizing infection. So in this presentation, I will be discussing the radiological features, imaging finding, and importance of MRI in diagnosing soft tissue infection and abscess. Now, I would like to show you my lab demonstration video.
Hello everyone, welcome to our lab. Today I will be presenting a short case on the topic soft tissue swelling due to infection or abscess, where this is the most common type of infection which is caused due to small cut, injuries or even surgeries. Radiologists helps them to identify how deep is the infection or the abscess. Abscess means accumulation of unwanted fluids. So we have one case where there is one 35 years old male and he is suffering from leg pain and and the pain and where there is pain there was redness and swelling, which is a suggestion or indication of infection. So we did an radiological examinations where we did x-ray just to find if the bone were in a good conditions or if there were any gas accumulation. After doing our radiological examination, the x-ray shows that there was an soft tissue increase, which is soft tissues increase, but there was no any gas accumulation or any other bone abnormalities. So in this case, we found that there wasn't soft tissue infection due to abscess or infection. So in last, I would like to say that soft tissues infections are not only diagnosed by X-rays, but it can also be diagnosed by ultrasound, where ultrasound helps to find where the deep accumulation of deep dark fluids and where there is no any blood flow. And MRI helps to find about complicated or complicated or infectious type of infection. Thank you.
Now, I would like to show you my research paper. So, this is imaging of musculoskeletal soft tissue infection by Martin B. Turkey. Now, now soft tissue infection of the musculoskeletal system are common and can range from mild cellulitis to severe necrotizing infections. Early and accurate diagnosis is essential to prevent complications such as abscess formation, tissue tissue necrosis, or bone involvement. Imaging plays a key role in detecting these infections, understanding their extent, and guiding management. MRI is the best method to dedicate and study soft tissue infection because it shows clear details of muscles, fat, and fascia. It helps find inflammations, abscess, and the spread of infection early. MRI uses different image types like T1, T2, STIR, contrast to see infection depth and clearly. MRI, it is safe because it has no radiation and highly accurate, but can be costly and time consuming. So now I would like to share you one book. Okay. This is a book which is written by Mohammad Reza Harry and his colleagues, and the title is Soft Tissue Infection and Their Imaging Mimics. Okay, so soft tissue infections are common conditions that radiologists encounter in clinical practice. This infection can range from simple cellulitis to complex necrotizing facilities and abscess formation. Because the clinical presentation is often non-specific like pain, swelling, or redness, imaging plays a key role in diagnosis. Uh, Radiologists should have a clear understanding of the full range of imaging findings seen in soft tissue infection because these infections can appear in many different ways depending on the cause, severity, and stage of the disease. By recognizing the various imaging features such as swelling, abscess, formation, gaps within tissues, or bone involvement, radiologists can accurately diagnose the type and extent of the infections, uh, differentiate it from other conditions that may look similar, like tumors and inflammations, and guide the referring physician in planning the best treatment, whether it involves antibiotics, drainage, or surgery. Now, I would like to show you one case-based YouTube video.
I'll be presenting today's Radiopedia.org case in radiology, Brody abscess. Case courtesy is demonstrated here, and the case link is in the description below.
So, this case from Radioapi.org is about Brody abscess.
Presentation: we have a 10-year-old male presenting with a painful right knee and fever. On X-ray, we see a well-defined H-shaped lytic lesion of the distal femoral metaphysis, surrounded by a thick, dense rim of reactive sclerosis.
So, in X-ray finding, there is a well-defined H-shaped lytic lesion in the distal femoral metaphysis surrounded by the thick rim of reactive sclerosis.
On MRI, we again see this well-defined lesion, which has an intramedullary location within the femoral metaphysis through the growth plate to the epiphysis. It displays low signal on T1 and a heterogeneous signal on T2. The peripheral rim, however, is isointense on T1 and hypointense on T2. This is the penumbra sign.
So, in MRI findings, the lesion is intramedullary, extending from the metaphysis to the epiphysis to the growth plate. It shows low signal on T1 and heterogeneous high signal on T2. It shows low signal on T1 and heterogeneous high signal on T2. A special feature seen here is the penumbra sign, which represents a rim of vascularized granulations tissue around the abscess cavity.
The penumbra sign represents a rim of vascularized granulation tissue around a bone abscess cavity that has a higher T1 signal intensity than the cavity itself. The radiographic and MRI features are most consistent with the Brody abscess of the femoral metaphysis extending to the epiphysis through the growth plate. A Brody abscess is an intraosseous abscess related to a focus of subacute or chronic pyogenic osteomyelitis. Staph aureus culture negative is most common. Proximal and distal tibial metaphysis is the most common location, as well as the femur and carpal and tarsal bones.
So, in diagnosis, there was finding consistent with a Brody abscess, which is an intraosseous abscess caused by subacute or chronic osteomyelitis, most commonly due to Streptococcus aureus. Common sites include the tibia, metaphysis, femur, and carpals or tarsal bone. Now, in conclusion, soft tissue infection can range from mild cellulitis to deep abscess and even life-threatening conditions. If not treated in time, radiological imaging, starting from X-ray, then ultrasound, and finally MRI, plays a key role in identifying the size, extent, and severity of infection. Among all, MRI is the most sensitive tool, showing detailed change in muscle, fascia, and fat, even before they appear on X-ray. A clear understanding of imaging findings helps radiologists differentiate infections from other look-alike conditions and guide clinical towards accurate diagnosis and effective treatment. Thus, radiology is not just about detecting infection, it's about helping patients heal faster through early and precise diagnosis. Thank you for watching.